This patient did 3 bone grafts on the upper jaw that failed, and he remained without teeth for years. But in 5 days, Dr. Genchev gave him back a full smile with basal dental implants. The bone loss on the upper jaw was total. The bone density was low and could not hold dental implants. The nails were used for the bone grafting procedure. They held up the mesh that contains the bone grafting powder, but it never hardened and remained like jelly inside the jaw. So how did Dr. Genchev do it? Dr. Genchev completed the dental restoration with no bone graft, no sinus lift, and no zygomatic implants. Dr. Genchev fixed 18 basal dental implants to compensate for the poor bone quality. The basal dental implants were fixed into the hard cortical bone to support a full dental bridge. Dr. Genchev fixed 3 tuberopterygoid dental implants behind the sinuses, 2 on the right and 1 on the left. In 5 days, Dr. Genchev completed the full dental restoration and gave him his smile back and the joy of eating normally.